Hey, let's debunk these healthcare lies that have been perpetuated for way too long because I'm getting sick of it. I'm sure you've had a time without number. Free healthcare, healthcare for all, no one will be left behind. Don't pay a dime, we got you covered. Wait, what? Free? But seriously, why do they lie through their teeth every time they say it? Well, I can see why. Is it not exactly what you want to hear? Exactly. This is appealing to our ears, to our votes, and to the headlines. This right here sounds like a promise of dignity. I mean, everyone gets free healthcare regardless of their income. It is a noble, compassionate, and a visionary thing to say. And to be honest, it makes them look good. It makes them look humane, as if they truly care. But this is what gets me. Behind this beautiful talk lies something else entirely. A system built on empty promises, political theater, and betrayal. So why don't we get right into it? You see, the government will keep announcing time and again that healthcare is free for all. But what it won't do is to fund the hospitals to match this promise. No increase in medication budgets, no staffing reinforcement, no budget for maintenance. So to me, this promise becomes just a slogan, not a system. And here comes the sad part. The patient will come to the hospital expecting care, only to find empty shelves, broken machines, and very exhausted workers. Come to think of it, this is like giving someone a bus ticket to a city that does not exist. How does that sound to you? Like a con job? Yeah, I thought so too. Actually, this is exactly what it is. It is a con job. Free healthcare is politically convenient to say. Like I said, it makes them sound humane and visionary. It grabs our attention, obviously. But behind the scenes, you ready? The people who are declaring free healthcare for all are also cutting budgets, diverting funds, and delaying salaries. So care becomes technically free but practically unavailable. As if that is not enough, they'll go around telling people, no one buys medications, we got you covered. But when patients say they still have to, suddenly it becomes health workers' problem. It's nurses' fault, it's doctors' fault, they stole medications, they stole them all. What? How morally corrupt can they be when they know too well no medications were stocked to begin with? I have to call all this behavior because it's reckless and it's dangerous. It erodes the trust between the health workers and the public, all in a very desperate attempt to hide their own incompetence. Why am I even shocked, by the way? These are the same people who parade new shiny machines and equipment, pose for photos, deliver powerful speeches, flash smile for the camera for the evening news, and you watching at home, you see progress, you see healthcare transformation. But for workers, they know the game. They've seen it before. They see mirage. Behind that glitter, there is no training, no maintenance budget, no plan to sustain anything. And this is not by accident, by the way. It's all by design. Do you wanna hear it? Because they know too well when that spotlight fades, they're gonna pack them all. Yeah, they're gonna pack those machines and equipment and disappear. And when everything falls apart, the health workers face the wrath of the public. They got to explain why they cannot offer services that they are supposedly equipped to deliver. They don't get it. That was just another photo opportunity. Their leaders are not keen to fix the system. They are busy selling an illusion of one. Free healthcare absolves our leaders of guilt, responsibility, and accountability. You see, when a patient dies due to system failure caused by them, they are quick to point out, but care is free. We've provided all the resources that they need, implying it's not their fault. It must be somewhere else, maybe with the hospital, or with someone else, maybe the health workers. So the workers are scapegoated, the patients are gaslighted, and the rot of the system hides beneath patriotic slogans. The cost of all this? The public loses hope and faith in our public healthcare system. The suffering continues, and a lot of time is lost. For health workers, it's the moral injury, it's the burnout, and the many months of unpaid salaries. And when they dare speak up, they are quickly silenced. How dare you stand up for yourself? Stop being greedy. Suck it up. Nothing is a calling. They weaponize our compassion, hoodwinking us into compliance, consistently, repeatedly reminding us to fall in line or get fired. Yet the same people who preach sacrifice cannot take a day of unpaid wages. What type of duplicity is this? They preach sacrifice while protecting their privilege. So free healthcare becomes a trap. The government looks good and generous. The public is misled. And the professionals carry the weight of a system designed to fail. The truth is, it's not free. It is paid by the exhaustion of those who keep it running and the lives of those it fails to serve. This is total betrayal. It is betrayal of trust, it's betrayal of humanity and oath of care. Because the people who built this shambolic system do not use it. When they fall sick, they fly elsewhere. Yet they'll be screaming to the top of their lungs. Healthcare is working, but they do not consume the same healthcare they boast about. And that right there is the ultimate proof there is a lie. And they know too it's a lie. But you know what else? We are not giving up without putting up a fight. Thank you so much for watching. Bye.